Hi everyone, it's Dr. Sharon Livingston. I interview physicians all around the country and actually all around the world. And today I'm here with Dr. Ali Sherzoy. And I want to introduce you to him because he is like the best kept secret in northern New Jersey, in my opinion. Dr. Sherzoy, can you just say a little bit, Dr. Ali, about what you do?
Yes, basically we do all of the cosmetic procedures. We do including the thread lift, Botox, fillers, lasers, hair removal. Those are the common things that I do here.
How did you come to doing that?
Well, I started basically as being a cardiologist. First, I was trained in the previous section that I said, so I started with veins. So basically, we started with bigger veins, and then we did the smaller veins, which is mostly cosmetic, and then eventually I did more cosmetic procedures. And before also, I was trained as a surgeon before, and then when I came here, I changed hearts, I went to medicine and then cardiology, but cosmetic was always, as a background, always part of my practice, but now I'm trying to do more and more of this in less.
What is your interest in the cosmetic aspect?
Because of the gratification that you get from the patients when we do the procedure. It's simple. The procedures are simple, in office, short, and the results are fantastic. And so when you see the patient comes in with the problem and then they go back and then look fantastic, it's fantastic. It's really gratifying.
That's wonderful. So, what other questions do people have about it?
Yeah, well, most people, they come in, says that, what is the PDO threads? Usually this is polydioxane. Basically, this is the same thread that the surgeon, when they suture the heart, the valve inside, they don't want to go back and try to remove the sutures once you're done. So
right.
these are dissolvable sutures. So basically the same thing when you do that, the body itself, over time, it gets dissolved. So,
so how long do they last then?
About a year, sometimes more, sometimes less. But on the average, when the patient comes in, I say about 9 months to a year, but sometimes actually could even last a little bit longer.
That's interesting.
Also, the other common thing is the cost. How much does it cost? What is the downtime? How long will it take? And how much lift can I get? So that I'm going to come back to that when we explain the procedure as well. That's what we're doing. Yeah.
Okay.
So when the patient comes in, first thing that we do, we clean him again. We have got this gauze, we have got antiseptic and also some alcohol, so we can clean up the whole face actually, so that because I'm going to be touching all over. Then suppose to ask the patient to see what's the what type of threading, what kind of procedure we do. Suppose they said, I like my jowl, this is the side I don't like. So then what I would do, I would make a mark, so this is the thing, is that so we start from, he says, for the jowl, I'm going to start right down from the top of the thing and make some marks. This is the jowl. And then he says, I don't also like my corner of the mouth, so I'm just going to do, he says, from the area, my corner of the mouth. The way that the threads work, basically, these are threads, but you have got these little hooks. So,
but they're tiny.
Yeah,
they don't hurt.
Exactly, yeah. So tiny. So that's why. So this is the way it comes. So this is the needle, and the thread is at the end of it, right? So now what I do. So what I will do. So I'll put the thread in right here, and I come from the other side. I pull it in. So the thread comes up, and so it goes underneath the skin. So now what I'm half of the thread is here now. So what I'm going to do. So this one now I cut this portion and pull it out. So when I pull out, it doesn't come out because these little hooks will catch on. So when I pull, I can pull the jaw line along with it. And then when it's really pulled to a level which I wanted, I usually ask the patient also how much to pull. Because when you pull, it kind of gives you a little bit of a wrinkling, it's got a little bit of a puckering.
Right.
So this thing I ask the patient to make sure that, if you have got something to do tomorrow or something, so that they don't have to pull too much. But he says, I don't mind, Doc, pull, so I can pull more. The
because
more I pull,
a few days later, it's going to go away.
It's going to go away, exactly.
Right.
Before that, we see that as far as they're going to come, does it hurt or not? We've got numbing medication, so what we do, we've got the needle, we've got the lidocaine with some epinephrine mixed, and then we're going to put the needle, and then what will happen that once I get it, I'm going to make a little injection there, and then a couple of shots on the track, a couple of shots on this track, so this way when we do our injections, now it's not.
And you could do it on the neck, you could do it on the cheek, where else could you
Correct,
do it?
yeah. So those are the places. So we can do it on the neck. On the neck, we're going to start here, like this, the same thing for the neck. So start from here on the back, and then I can go like this. And then if you want around the chin here, we can put another one there. If you want to do another one there, we can go there. So all pressure. The other common pressure, so this is actually the three common places on the face. One is the jowl, one is what we call it marionette line, and the other one is the nasolabial fold. So we can put this one a little bit further down if you want to get where the fold is. And the other thing is the eyebrows, that we can give them the cut eyes. We can put it like this.
Oh, that's so interesting.
Yeah, and then otherwise, if you want to suit the middle of the eyebrows, then we can do it.
What's the most you could do on any one face?
Or we can pull the whole face. You can pull the whole face. That's what we call it, the non-surgical facelift, basically. The other thing is that, so another thing, well, part of the non-surgical facelift, I usually combine them. So I combine the threads, because the three Ds of the skin, right? For the gravity,
right,
I'll pull with the threads, and then for deflation, I fill up. You fill up a little bit here, fill up a little bit there,
with fillers.
With fillers, a little bit of tear trough. And then the other thing is, the third thing is for degradation, I do a little bit of Botox here, and then some micro needling or a chemical peel or whatever else. So we can do all three, and then and then basically we come out with a facelift almost.
Wow, that's amazing. Who is a good candidate?
Yeah, that's a very important point. The quality and type of skin is the important thing.
And so how would somebody know? Do they have to come in and see you and you have to evaluate?
Yeah. I think the best thing is that, because suppose over the phone is tough to tell them. Sometimes I do the virtual thing, so I can get an idea what the.
Oh, that's a good idea.
Yeah, so on a virtual, so I can see exactly what the problems are. But again, it's not as good as when you come in and you touch the skin and you pull the skin to see what is the elasticity and how much bounciness it has and all that. That you can do it. You cannot do it on the video.
So, we've been working together now for a while, for a couple of years really, and it seems to me that you personally are more excited about threads than you've been.
Yes, because the results that I get from it, it's the best. Because one of the, again, come back to 3Ds, once it descends thing, one of the mistakes that the people do, like it happens even in big stars, I don't want to name on this thing, but they go there. Suppose if they've got descents here, instead of pulling, they just fill. So what will happen, if you do something which needs pulling, when you fill, it gets bigger and bigger and really get ugly. So it's not that. So if it needs pull, you have to pull. You cannot compensate by filling just something that needs pull.
Right, it's like a loose bag that...
Exactly, when you fill it, it just doesn't look natural.
Right. So, typically someone who's coming in, how many threads are they doing and what is the cost?
Yeah, so it depends again what they need. It depends if somebody says, okay, I want to pull my neck also, so pull my jowl, corner them out and all that. So as you can see, like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 threads on one side.
Wow.
So that's what, but this is extensive. So that means 11 to 12 threads on each side, about 20, 24 threads, that you're going to get a fantastic, this is you're going to get actually a mini facelift. Facelift. But if somebody says, come back and says, okay, I just want to lift my jowl, I think 2 threads will be good enough. Even sometimes one person is younger and does not have too much, I said, 1 on each side will be good. So depending on how many threads, as far as the cost is how many threads. Each thread costs between around, depending on type of the thread, the length of the thread and all that, between 200 to 350. That's the range. So that depending on how many threads that you put. So if you put 1 on each side, that's about $500 to $600. But if you majority have put 2 and 2, that's on the average is about $1,200. So that's at least the one that I charge.
So if somebody if they were doing the whole thing, to get that facelift, if they were actually doing a facelift, plastic surgery, what would that cost?
That different plastic surgeons charges different amount because you go there, but the cost is much more. I mean, they cost between $18,000 to $20,000 to $25,000 if you do it. And there's not only, but then you're talking about $25,000, but at the same time, your anesthesia, your downtime. When you come back, you're going to be like a balloon. Recovery is going to 3 to 4 weeks to recover. This one, the recovery time. Actually, your recovery time is actually nil. I mean, depending, but if you really put too many threads and you're a little bit of swollen, it's got that, maybe 24 to 48 hours.
That's awesome. That's awesome.
Yeah.
Well, what are we going to talk about next time? So when you come back, folks, we have another interesting topic for you. What's it
Yeah,
gonna
so
be?
basically next time I'd like to talk about fillers, because the same thing, like we said, descent, so now we've pulled, the next thing is deflation, so we're going to fill, we're going to talk about filler, and the third time we've got about the third D, which is degradation, then we've got to talk about the Botox, about the chemical peels, about microneedling, about lasers, so those are things that we can do with this.
Well, thank you, Doctor.
Oh, thank you.
It's a pleasure always talking with you.
Same here.
And if you'd like to get in touch with Dr. Ali, what's the phone number here?
Phone number, we can use it 201-569-0920.
And what I'm going to do is, you'll see below, I'm going to put the website where you can contact Juliana and Dr. Ali to set up an appointment to find out. I mean, if someone just comes for an evaluation,
Yeah.
what does that cost?
I don't charge. 15 minutes, free consultation, because I don't feel like
That was
pleasure.
wonderful.
Pleasure.